Welcome back, friends, to another episode of the Athlete Unfiltered. I'm Thomas Kauffman. I'm your host, and today we are talking about stress fractures. What are they? How do they happen? What can you do to best avoid them? And if you get one, what to do to recover? So, one of the first questions that comes up is, what is a stress fracture? And it's as easy as thinking, if you've ever seen a wall with a crack, small one, medium one, large one, that is essentially what's happening in the bone inside your body when you have a stress fracture. You have a small crack, medium crack, or longer crack in the bone. Now, this is not a through and through break of the bone, but it is still going to be painful when you apply pressure, when you offload it, and even when you just squeeze the leg. It's going to be a very painful sensation. And depending on where it is, you may actually put a little bit of load. You may actually not put any load in your system. So, stress fractures are small cracks in the bone. If you want to look at one, just Google stress fracture of the tibia, and you'll get an idea of what it looks like. Now, it doesn't always appear on an x-ray, which is the first thing that your clinician or doctor are going to end up requesting so that they can confirm or deny the existence of a stress fracture. Now, just because it doesn't show on the x-ray doesn't mean it's not there. If you've been dealing with excruciating pain for 2 to 3 weeks, you can't load your leg or the limb that you are utilizing and loading. It's painful when you wake up. It's painful when you go to sleep. You're probably dealing with a stress fracture. So, how do these stress fractures occur? Well, from the simplest terms, they occur because there is a discrepancy between how much load your bones are absorbing and how well they recover between one training session to the other. Now, do stress fractures only occur in runners? No, they don't. They're going to occur in every single sport. You could be a football player, a wrestler, a cheerleader. You could be a gymnast, a dancer. There's a chance that you are going to get a stress fracture if you are overloading the tissue and are not recovering properly. Now, when we're talking about overloading, we're not talking about lifting weights and getting too heavy. That could also cause a stress fracture, but that would be of the spinal column. But we're talking about just the everyday stressors of your sport. If you're a dancer, most likely, being on your toes are going to cause a stress fractures of the toe metatarsals. From a runner's perspective, you could get metatarsal stress fractures. You could get calcaneal stress fractures, which is your heel. And you can also get tibia or even femoral head stress fractures. And these are stress fractures in different areas of the leg. And they're always going to be secondary to a discrepancy between how much load you are applying to it and how well this tissue is recovering. Now, let's talk about load first, and then we'll talk about the recovery. So whenever you are applying a lot of load or repetitive load, right, because these are repetitive stress injuries, your bone goes through a process of breaking down. So inside the bone, you have two processes. You have your osteoclasts, which are removing stressed out, worn out bone. And then you have your osteoblasts, which are repairing that bone. Okay. So between one and the other, they are maintaining the health of the bone between training, whenever you sleep. That's part of your recovery. If you're doing too much, your osteoclast activity may be higher, and therefore you may need a longer recovery session so that the osteoblast can come in and repair the areas that have been demolished by the osteoclasts. This will allow your bone to adapt to the stressors and be stronger and more resilient to future stressors. One of the problems that we often see with athletes is they don't really have a lot of control of how much load they're applying through the week. High school and collegiate athletes typically have track sessions every weekend. So they have competitions every weekend, and they have a lot of training throughout the week. It's pretty hard, and they can put a lot of poundage on those legs. In some instances, especially if they are running for a school, athletes don't really have the ability to say, I'm not going to run this, or I'm going to take it slow today, or I'm going to do a recovery run. They usually have a training plan in effect. Now, we always encourage athletes to talk to their coaches and their athletic trainers, and we encourage you to do the same thing. If you don't feel recovered, talk to your coach about it. Let them know. That is one of the first steps to avoiding unnecessary injuries, especially in this realm of repetitive stress injuries. If they can't do anything about it because it's part of your training, then we want to look at how you are recovering. What are the recovery strategies that should be in place for you that you may not necessarily be doing? And the first one is getting enough food. A lot of times, runners want to maintain a lower body weight. Therefore, they're not going to consume enough calories to increase their body weight, thinking the idea that if they don't consume a lot, they're not going to weigh it too much, and they're going to be faster for the race. Now, the problem here is if they are not eating enough, they may not have the energy to perform at their dedicated event, and they're also not going to have the energy to recover from that event. So the first things that we want to look at whenever we are talking about recovery strategies is making sure the athlete is eating enough calories. Now, once they're eating enough calories, we also want to make sure that the athlete is intaking enough calories or enough foods high in vitamin D, calcium, magnesium, and potassium to maintain and help that recovery of the bone. Now, in most instances, athletes don't really, especially if they're in college or in high school, a lot of the food that they're consuming is not high in vitamin D, and it's also not high in calcium. So there are a couple of over-the-counter supplements that could help with intaking more vitamin D and more calcium into the system. That is your nutrition part. What else can we take a look at within your recovery strategies? That would be your sleep. How long are you sleeping? Are you sleeping good? Is the quality of your sleep up to par with your recovery? Are you waking up feeling refreshed and ready to work, or are you waking up extra sore, tired, groggy, like a bus just hit you? If that's the case, you may not be getting the best sleep that you possibly can. And while getting off your phone an hour earlier before you go to bed and wearing blue light blockers and doing your infrared sauna and your red light therapy might help improve your recovery, the best thing that you can do is create an environment in your room. As an athlete, create an environment in your room that is dedicated to sleep. That means it's colder at night, it's dark, and you have a noise that is going to help you fall asleep. For example, my wife loves white noise from her fan. If she doesn't have that, she doesn't get any good sleep. So you may want to get a fan. You may want to get a white noise machine, something that is going to help you block out external environment stimulation that may wake you up. Now, if you live in a dangerous neighborhood, just get a good security system and, keep an eye out for yourself. So those are a couple of things that you can do to improve your nutrition and to improve your sleep. Now, part of improving your nutrition and your sleep, it also comes how well you manage your stress. If you're too stressed, there's a lot of individuals who binge eat. There's a lot of individuals that don't eat at all when they're stressed. So if you're not managing the stress of work, school, friendships, social interactions, training, etc., you're not going to be managing that stress, and you may be defaulting to bad habits, right? You might get too stressed and reach out for the ice cream, and then you won't eat for 2 or 3 meals. You might be too stressed and not eat at all for a full day and then go to practice the next day. Or overall, you might be too stressed that you're not going to sleep throughout the night because you're tossing and turning. That happens, right? There's a lot of people out there who cannot turn off their brain when they're going to sleep. So you have to have different strategies on how to better manage those external stresses in order for you to have a neutral or a very calm inner stress. If you're able to manage the outside stressors, then you're able to manage how you react to them. So a couple of things that you can do to manage those external stressors is journal, meditate, talk to somebody. Those are the biggest 3 that may help you get the thoughts off your mind, put them down in paper, bounce your ideas with somebody else that may help you see a different way or find different strategies that are going to help you manage those external stimuli better. So when we're talking about recovery, we're talking about nutrition, sleep, and stress management. Now, in order to treat a stress fracture, what are some of the things that you can start doing at home? So if you suspect that you have a stress fracture because all of a sudden let's say your leg, the tibia, is starting to hurt and you're putting a little bit of pressure on the muscles on the front of the leg and it hurts, and you push a little bit more on the bone and it hurts, you might have a shin splint. You might also have a stress fracture. If you have pain when you load the leg and you offload the leg, you most likely have a stress fracture. So the first thing that we want to do is change the activities that you're doing. And this doesn't mean that you'll never run again. It just means we have to offload the leg, but still stimulate it enough so that it can recover. So if you're running and you're a runner, you might want to take on swimming. You may want to take walking inside the pool. You might want to take some cycling, that is low-level stimulation to the leg, but still stimulates the muscles, tendons, and bone repair of the area. That is the first step, offloading it from running and introducing an activity that is low level. Still stimulates the system, but it's not a lot of load and a lot of poundage. The other thing is going to be finding movements that do not aggravate it. If your stress fracture is in the foot or the tibia, there's very little movements that are not going to aggravate it. Walking is one of the main movements that we would normally prescribe to an athlete, but in these instances, cycling might be the best one. Again, swimming is one of our favorite ones when it comes to stress fractures. If you're not able to change the activity, then you might want to, or you might get a boot to offload a lot of that stress, and you can walk for the most part. You'll still have some limitations, so you should set up some limitations so that you don't overstress the body by walking all day long on it. Trust me, I've had patients like that. Now, if the pain is so severe that when you go to sleep, your leg is just aching and pulsing and the pain is still there, it's time for you to see a clinician. Now, the best thing for you to do is the moment that you have pain and it doesn't go away within a couple of days, maybe 3 days, seek the help of a professional. If you've already offloaded your leg, you've changed your activity, you increased your sleeping, you're eating well, and it's still not getting better, go to a clinician, go to a sports physician, get checked out, make sure that there is nothing serious. Okay? So, can we avoid stress fractures? Yes, we can. We have to be smart about it. We have to be smart about how much load we're inputting into the system and how well we recover from that load. What are our recovery strategies? Are we sleeping well, sleeping long, sleeping enough? Are we eating enough? Are we eating for performance? And if we are eating foods that are high in calcium, high in vitamin D? Are these foods going to help sustain bone health? If they're not, might as well start changing them now. Get into the habit of eating cleaner, more nutritious foods. And finally, are you managing those external stressors that are taken away from your physical performance? And typically these stressors are mental stressors, right? Like we talked about earlier, things that keep you awake at night, that may stress you out so much that might make you skip out on meals, that might make you overeat, that might make you binge eat. There are different ways, and everybody is going to find a better way for them to manage these stressors. And again, like we said earlier, could be journaling, could be meditating, could be talking to somebody. So just keep your mind open when it comes to how can you manage those stressors. Not every solution is fit for every individual, and every individual is going to find a different solution to manage those external stressors. Now, if you are struggling with recovering from an injury and you're tired of it and you want a solution, give us a call at 636-224-8587, and we can talk about how we can help you And if we can help you, what does that look like for you? So, thanks for tuning in. Today's episode is a little longer than what we expected, but I hope you guys get a lot of good information from this. If you did, please subscribe to the channel, give us a thumbs up, leave us a comment on any other topic that you may want to learn more, and we'll see you guys next time.